My name is Wendy Davis. I am a student at the Kent School of Social Work and Family Science at University of Louisville. I would like to address a pressing concern toward our elderly. Elderly poverty is a social issue that requires our attention, but it also requires attention from our government and our policymakers. Both of them combined need to come up with a more effective policy and program that can provide a better financial stability for our elderly. Did you know that 10% of the people age 65 and older are living in poverty? And did you know that over 25 million Americans are economically insecure in the United States? That means they are living at or below 250% of the federal poverty level. Many of our elderly have worked most of their lives. They have paid into a system called Social Security. This was supposed to be a security blanket for them when they were unable to work and retired. But according to the U.S. Census Bureau, it is predicted that in the years of 2042 to 2045, that if our government does not intervene and change our current Social Security program, that program will be cut with funding shortfalls, which will lead to benefits being cut. If our elderly are already struggling financially and 10% of them are living in poverty, I can't imagine being told that your benefits are being cut and how they are supposed to deal and with that situation and the hurdles that they might face. I don't feel like an elderly person should ever have to determine if they're going to eat or buy their medication, or if they're going to pay their rent, or if they're going to go to the doctor. That should never be something that has to cross their mind, but unfortunately that is what's going on in our world today. It's essential for us to continue to support and expand these social policies to ensure that our older individuals don't have to struggle financially and they can age in dignity with financial security. As of right now, experts are saying that if someone retires and wants to live comfortably, they would need to make at least $66,000 a year, which, depending on which state you live in, might be more or a little less. But according to Social Security, the estimated average retirement benefit as of January of 2023 is only $1,827 a month. If you take that number and you multiply it by 12, it only comes out to be $21,924. That number sounds just a little bit off from that $66,000. You expect these elderly individuals to try to make that amount stretch in our current economy? Yet Social Security is supposed to protect our elderly individuals from being in poverty. I propose that policymakers expand funds for Social Security. This may require you to reassess our federal budget, move priorities around, consider alternate resources of revenue, such as increasing taxes on higher income individuals or implementing a wealth tax. Securing necessary funds is essential. It is essential so our Social Security and Medicare programs will continue to be accessible. Healthcare is essential for everyone, yet Medicare is not free. Policymakers, can we look into a more affordable Medicare program for our elderly? Medicare Advantage plans are great. They help cover dental, vision, and prescription costs, but yet it's not affordable for all elderly. Can we reform Medicare to make it more affordable, to help cut the cost of coinsurance, co-pays, and prescription costs? Something has to be done. Something has to be done for our elderly now, but this problem is not going to go away. If policymakers can reform it now, then this could become a long-term change for future generations to come. Thank you for your time and consideration in listening to some of the social issues that our elderly population is currently facing.